Hello and welcome back friends, I am Dr. Ankit Gupta and this is part 2 of your tummy tuck video. In the first part I have already explained what things you need to know before the surgery, and this video is about your results, your recovery and the risks and the complications of tummy tuck surgery. So if you have not watched the first part, first go and watch the first part, the link is there above, and after that you can watch this video which will answer I think almost all the questions you have regarding tummy tuck surgery. Hello friends, I am Dr. Ankit Gupta. I am a board certified plastic surgeon and I practice in Delhi, Pitampura under Panache Hair Laser and Plastic Surgery, and we do a lot of cosmetic surgeries at our center, and today's video is on tummy tuck part 2. Most important questions: will there be scars? Yes, you will have a scar, but this scar is a fine line which extends from the bone, that is the anterior superior leg spine, as you can see in the picture, from one corner to the other, and this is a fine line after it heals. And it is hidden in your bikini area. It is similar to a bikini line scar which is hidden in your underpants, and yes, but it is not that bad a scar because it is usually hidden and only your partner will get to see it. This scar will take care of all the loose skin that you have in your tummy. So all the loose skin is being removed, and this scar is nothing compared to how your loose skin looks as of now, right? How long will there be scar? So there is a saying, once a scar is a scar for life. So there will be a scar for life, but this scar improves over a period of 1 to 2 years and gradually it fades, but it will never go away completely. In us who are brown, we are all brown, there is always some amount of pigment, hyper or hypopigmentation in the scar area, and it will become less visible, like what you have if you have a cesarean scar. It becomes less visible over a period of time, but it will be there. Okay. What happens to the belly button during the surgery? Yeah. So when we do a tummy tuck surgery, usually the skin from your pubic area to your belly button, all of the skin is removed. So all the skin right from your pubic to your belly button is removed. Now the belly button is cut. It remains inside, attached to your muscles, and the skin is pulled down and stitched to the pubic area, right? So wherever your belly button was supposed to be, at that point we make a hole, bring out your belly button and stitch it to the original area. So your original belly button remains the same. It is stitched to the area where it should be, and that is why the belly button's position will become a new position which is aesthetically pleasing, and it will have a new position. It will not come down along with the skin. Okay. Will my belly button look natural? Yes, we try and make your belly button look natural, and the shape improves after the surgery, because right now what happens is the belly button, which should be vertical, becomes horizontal. We try to make it look as natural as possible. Okay. Will there be drains used after the surgery? Yes, I always prefer to put drains because drains are safety, and there is nothing coming out of your drains. I would still put it because drains will suck out all the liquid, all the water of liposuction, and if there is in case any amount of bleeding, it will take care of all that and everything will get collected. It will be a good tool to monitor you, and it is a safety tool. So I always put drains, and I remove it after 3 to 4 days of your surgery once the output is less than 10 to 15 ml. In your case, do I need to wear a pressure garment after the surgery? Yes, you have to wear a pressure garment which starts after the drains are removed. Till the time the drains are there, it creates a negative pressure from inside. You don't need a pressure garment. After the drains are removed, you need a pressure garment, and I advise you to wear it for 2 months. Okay. How painful is the recovery? So with the advancement in the anesthesia and the pain medication, the recovery is very smooth. During the surgery, you don't feel anything at all. Even after the surgery, midline where we have stitched the muscles, we give anesthetic agents, long-lasting anesthetic agents in that area so that you don't feel the pain. While you are lying down, you do not have any pain at all. It is only when you are trying to get up or move around, you will have discomfort, which is usually there for about a week or so and gradually disappears. How soon can I walk after the surgery? So you are recommended to get up from your bed at least the next day, if not the same day of your surgery. The next day you are supposed to walk for at least 10-20 steps within the hospital. I would recommend you walk for at least 10-15 minutes, maybe in small intervals, 2 to 3 times in the second day, and after that you are discharged. You are allowed to walk around at your home. Okay, so you are allowed to walk, at least you need to walk, or you have to walk the second day of your surgery. When can I return to office? So I usually recommend 12 to 14 days of leave after your tummy tuck surgery for you to become active so that you can join back office. If you have your own business, own work, maybe you can start working from home within 4 to 5 days, but if you have to go to office, travel, maybe 2 weeks. Okay. When can I lift heavy objects? No heavy lifting for at least 1 month after the surgery, ideally 2 months. Okay. When can I exercise? Cardio and all after 1 month, and proper gym after 2 months. How long does the swelling last? This depends on amount of fat that is left on your skin and how much of fat you had before the surgery, and it can last for up to 2 to 3 months. Usually it takes 1 month, but in those who have a lot of fat, it can last for up to 2 to 3 months. Okay. When will I see the final result? So again, it is at 3 months you see the final result. These results keep improving, but 90% to 95% of the recovery is within 3 months. Can fat return after the surgery? So if you keep gaining weight, the fat will return, not that much in the area where tummy tuck was done, but in the areas other than your body. But if you gain a significant amount of weight, say 20 kilograms, then the fat will also return to the areas where tummy tuck has been done. Will I have numbness after the surgery? So in the stitch area, stitch line area, you will have numbness, and it can be persistent for about 6 months to a year, and gradually it comes back, your nerves grow, and it will take care of the numbness, and then the numbness goes away. So guys, I have answered around 25 to 26 questions, and I think there are still 25 more questions to go. I'll make a separate video, maybe a part 3 of this video, in which I'll be answering the rest of the questions, which are like complications, risk of blood clots, seromas, and all those things. So if you have watched my video till now, I think you will be interested in knowing about the complications as well. So do watch our third video as well on tummy tuck. I'll try to make it as soon as possible. Thank you and have a nice day.